my name is Dr. Chris Slininger, and I am an upper cervical chiropractor. I practice in St. Petersburg, Florida, and Brandon, Florida, with the Upper Cervical Centers, and I'm also the executive director of the Advanced Orthogonal Institute. Upper cervical chiropractic is a very unique form of chiropractic care, and it should be distinguished from the rest of the field so that it's easier to understand exactly what an upper cervical chiropractor does and exactly what this advanced orthogonal procedure is. Now, the advanced orthogonal procedure that we use at the upper cervical centers is a type of sound wave correction to the upper cervical spine. So we actually only use a percussive sound wave instrument to make alignment changes in the craniocervical junction. And I'm going to break down that craniocervical junction so you can understand why that area would have so much attention put on it and why it's so sensitive to the health of your body and your brain. Now, this percussive sound wave instrument is the most gentle form of chiropractic that's possible. We're actually only using percussive sound wave in order to move these bones. So there's no twisting, cracking, or popping of the spine. It is completely painless. And because we're able to use vectored corrections, which are adjustments on very specific angles that are calculated from x-rays, we're able to make very precise changes that we can calculate both before and after the correction is done. But first, let's talk about this craniocervical junction, this upper cervical spine. Why is the upper cervical spine so important? Well, first and foremost, the upper cervical spine is the junction point between the brain and the body. The brain has to send signals down to the body in order to tell the body what to do. A good example of this not working well, a very extreme example, is Christopher Reeves, old Superman. So Christopher Reeves, he was an equestrian. Everybody knew him as Superman, but he loved riding horses, and he fell off his horse and he broke his neck, and it crushed the top two bones of his neck, the atlas and the axis, and the broken bones destroyed the spinal cord underneath of it, and he lost all function of his body. And it's not because he lost function of every part individually. He didn't break every bone, he didn't tear every muscle, he didn't destroy every organ. All he did was lose the signal between the brain and the body stopped functioning completely. Now, when you have a misalignment in the upper neck, instead of it destroying the spinal cord and severing those nerves and the signals, it's interfering with the signals between the brain and the body. So although the brain is trying to tell the body how to function properly, it literally cannot because the signals are not getting through correctly. Just as important as that is the brain needs information from our body in order to know exactly what to do. So the brain collects information from nerves all over our body: pain nerves, temperature nerves, pressure nerves, joint position nerves. All of our senses tell our brain exactly what's going on inside of our body, and that way the brain can make adaptive changes and then tell the body how to function correctly based on that information. So if you have interference either direction between the brain and the body, it shuts down the appropriate function of the body and your health will decline naturally. And that's why we end up with pain, problems, diseases. It's not because we have all these individual problems. It's usually because of an underlying dysfunction in the body. And it's really important to understand the idea in all of healthcare of getting down to the root cause of the problem. You see, if you just try to deal with surface issues, if you just try to deal with the symptom of a problem, you're going to make something feel better without actually making it better yet. I just talked to an arborist just a couple days ago, and I was talking to him, and I said, you don't go around and say, hey, that tree is not as green as it should be, so you get the spray paint out and spray the leaves green, so now it looks like a nice bright green tree. He said, no, of course I wouldn't do that. I said, what do? He said, well, usually if the tree is not healthy at the top, it's revealing that something's wrong at the base, at the root. And so he has to always look down to find out why the tree going up is not growing the right way or is not as healthy as it should be. You always go down to the root, and he finds that it's a watering problem or a construction problem. He was saying there's all sorts of interferences that can take away from the vitality and health of that tree, but you usually find it at the root, not at the top. And unfortunately, we deal with the health of our own body differently. We will start to focus on the symptoms, which is like focusing on the crown of a tree, and we try to mask the symptoms or change the way it's perceived or felt, like spraying it green, as opposed to dealing with the underlying root cause of why your body's not working in the first place. So we always want to keep a root cause mindset when we approach health issues. And very often we'll find that one very significant root cause of a problem can be found in the upper neck. Now, we talked about interference in the upper neck area. That interference can come from misalignments in the bones of the upper neck. Now, the cranio-cervical junction, which is the bones at the top of the neck, it's made up of the bottom of the skull, the atlas bone, which is the top bone of the neck, and then the axis bone, which is the bone right under that, or C1 and C2. Now, when these bones get misaligned on one another, they can start putting pressure on these nerves, and they can pull on these nerves, and it disrupts the nerve signals going between the body and the brain, as well as the brain to the body. And this disruption is what often leads to this dysfunction. But this is not the only thing that goes on when you have a misalignment in the upper neck. Now, when you do have a misalignment, it causes a lot of very consistent symptoms. Neck pain, headaches are very, very common. You can end up with sciatica, which seems a little bit weird because it travels down the back of the leg, but the nerves that travel down the back of the leg come from nerves that ride along the side of the spinal cord right through the neck. So when the bones get misaligned in the neck, it tugs on it, causing a pain that mirrors or mimics sciatica. So your low back and pain down the back of the leg could actually be rooted in the neck. Again, it's the root cause versus just the symptom of it. Where is the root? It's what we always have to ask. Now, this upper cervical misalignment can also cause posture changes. And these posture changes can show up as tilts in the head, uneven shoulders, imbalanced hips. Sometimes you can have tight hamstrings, tighter on one side than the other, knee pain, hip pain, back pain, shoulder pain, neck pain. All of these things are interrelated because the upper cervical spine, the craniocervical junction right here, has within it something called the vestibular nucleus. And a good way to think of the vestibular nucleus is the posture control center. So this vestibular nucleus in the craniocervical junction sends signals down to all the muscles that support your posture upright against gravity. So whenever you're standing upright, everything that's engaged to keep you up is actually being controlled right here at the upper neck. So any interference in this vestibular nucleus or the vestibular system can cause imbalance, posture issues, a breakdown of your posture where you start slouching slowly and it becomes harder and harder to sit up. And it's not because each individual bone or each individual joint is broken down, but the overall system has actually broken down. This is why we see so many people with one-sided degeneration. One knee will break down versus the other. One ankle will break down faster than the other. One hip will keep going out and not the other. If you're walking the same amount of steps on both legs, why is one giving out and not the other? They should wear out evenly, and if they're not, there's probably an underlying root cause to the imbalance of your body that would lead one side to break down faster. So if you want to understand why your posture would break down, first and foremost, look to the neck. Now, it seems a little bit weird. Why wouldn't you evaluate the other areas of the posture first? Just think about this for a second. If you were walking down the hallway of your house and you noticed the light was out, so you look inside and you notice actually the switch was on. So the room was dark, but the switch was on. So you'd probably play with the switch a little bit, make sure it wasn't a bulb. But then you notice that there was something else that was plugged in and that isn't getting power either. Maybe it's like an electric clock that was plugged in. It's not shining. So then you get a little suspicious and you check a couple other plugs. And you notice that no plug or switch in the entire room is working. Logically, you're going to say, hey, I don't think this is a bulb problem. I think this is a breaker problem. The whole room has lost power. Okay, so whenever you see a pattern of dysfunction in the body, just like you would in your house, you want to go to the root cause, the most logical root cause of why the whole pattern would be there. Now, look, if you see that the room has lost power, you check another room, that lost power, then you notice the whole house is out. Either you didn't pay your bill, or maybe the neighborhood lost power. It's probably one of the two. But if it's just one room, that pattern would indicate that you would go to the breaker. And in the body, the circuit breaker of the body is really in the upper neck. So, if you want to understand posture problems, start with the breaker switch that controls the whole system. And that's going to be found right here. Now, going through the upper cervical spine, we also have something called cerebrospinal fluid. Cerebrospinal fluid is fluid that protects the brain, and the brain floats in this fluid. It also nourishes the brain. So the entire brain is surrounded by this cerebrospinal fluid. Now, if you have a misalignment in the upper neck area, it can obstruct the flow of the cerebrospinal fluid as it flows around your brain and down the spinal cord. And that disruption of flow can cause a backup of fluid, or it can cause turbulence. So I'll break them down really quick. If the fluid is actually backed up, it means it can't drain out of the brain correctly. You ever hear the rule, don't drink out of still water in a stream? It's because still water is where all the gunk can grow. You always find the most bacteria, the most growth in fluid that's not flowing. And so if you have an obstruction of this cerebrospinal fluid and it's not flowing, it's going to collect waste, it's going to back up, and it's going to end up deteriorating the health of your brain. And now research has shown that there's some very strong links with obstruction of cerebrospinal fluid, which often happens at the cranial-cervical junction, and neurodegeneration. That's pretty significant. That means there's potential links here for Parkinson's, Alzheimer's, multiple sclerosis, and it's because the brain literally can't clear out. But not everybody's in that situation. See, some of the early signs of this, of obstruction of cerebrospinal fluid, it's just not flowing well, it's not getting out of the brain right, is you feel foggy-headed, it becomes harder and harder to concentrate, you become tired more often, you never really feel like you reach peak energy in the middle of the day, you become a little bit more restless at night. Basically, a good way to describe it is it's like a haze or a fog is just clouding your brain, or brain fog, some people will describe it as. And it feels like you should be smarter, you should be able to focus better, but you just simply can't. So this is very strongly related to cerebrospinal fluid obstruction, which often comes from a misalignment in the upper neck. Now, the upper cervical spine has some very important blood vessels that travel through it that go to the brain. You have your vertebral artery, which actually travels right through the atlas bone. It goes through little holes on the side and it wraps around to feed blood to the backside of the brain. So a twisting or a misalignment in that upper cervical spine can start to put pressure on these blood vessels and block the flow. It slows it down. And then you have an insufficiency of blood to the brain, which can break down the function of that brain. And in that case, it goes to the back of the brain, which controls a lot of balance and coordination. So dizziness is a very common symptom when somebody has obstruction here in that flow. You also have your carotid arteries, which go on the front side. And these are very big blood vessels, but they actually sit right up against the atlas bone, the top bone of the neck. They can be interfered with, but it takes a lot more because they're closer to the center, they're bigger, and they're pressurized. So it's usually going to be the vertebral arteries that get affected first when it comes to blood going to the brain. You also have jugular veins. I'm sure you've heard of them, but jugular veins are actually the main drain of the brain. So these jugular veins are responsible for making sure that the cerebrospinal fluid gets out of the brain, as well as all the blood that's being pumped to the brain to bring oxygen and nutrients also get out. And so when you have a backup or an obstruction or a compression of that jugular vein from a misalignment, it can back up fluid in your brain and build up pressure because the blood can't get out. And that's when you end up with pressure headaches. It can also be responsible for the cerebrospinal fluid backup that I was talking about before. So these are called the hydrodynamics, the fluid flow through the cranial-cervical junction. And a misalignment can seriously affect the hydrodynamics of the brain and break down the brain slowly. And last but not least, you have your limbic system. Your limbic system is the emotional part of your brain. Now, anytime you have a misalignment in the upper cervical spine, it starts to interfere with the signals going up to the brain. And now you have these neurological connections going from the upper neck and even the joints of the upper neck that travel upward, and they actually go to the limbic system. And when they get to the limbic system, one of the main things that they do is they drive your body into a fight or flight response. Now, the fight or flight response, I'm sure you're familiar with. It's when somebody jumps out at you and scares you. And when you get that fear, that sudden impulsive reaction that somebody just scared you, you notice your body changes pretty dramatically. Okay, so your heart starts pounding out of your chest, which means your heart rate and blood pressure go up. your blood is getting diverted towards your arms and your legs, because in a fight or flight response, let's say this was a real threat, you'd literally need to fight or you would need to run. Either way, the blood needs to go to the areas that will help you with survival. Now, the parts of your brain that are important for problem solving will start to shut down. They are not used very well in a fight or flight response, but all your responses are heightened because it helps you survive. So it's very hard to think clearly when you're in a fight or flight response. It also shuts down a lot of your organ function. Basically, you don't need to digest food, you don't need to poop, and you don't need to pee if a bear was attacking you. Those are not important things. Survival is important. You can deal with those other things later. So the body changes its function to support survival. Okay, and then your immune system and your healing rates will also go down. And a good way to think about this is a bear will always kill you faster than a bacteria. If you're in an imminent threat, an infection is not the primary concern. But once you get out of that imminent threat, then it's time to heal, and then it's time to deal with the immune functions to make you well again. So your entire body changes simply because you go into this fight or flight response. The challenge with this is when you have a misalignment that's not corrected day after day after day, it creates a fight or flight response that lasts much longer than a short-term threat. Okay, if you were actually hiking in the woods and a bear attacked you, you'd want to run, you'd want to get out of there. Okay, if you were in a real threat situation, as soon as you get out, it would shut down and you would go back to the rest and digest state of that emotional center of your brain. But in this situation, it never shuts off. Day and night, you are in a fight or flight state. And because of that, you end up thinking poorly, your blood pressure goes up, your heart rate stays high, your muscles stay tense, your digestion is poor, it becomes harder to poop and pee regularly, you're immunocompromised on a regular basis, which means you'll get sick more often and you don't heal as well. All of these things are related to this upper neck misalignment because it drives your body into this sympathetic state. So the question has to be, how do we correct this? How do we change the outcome? And thankfully, there is a way to correct this, and it's called upper cervical care. And the specific type of upper cervical care I use is called the advanced orthogonal technique. Now, as an upper cervical doctor, there is a standard for how we evaluate if you have an upper cervical problem. First thing we do, which is the most important, is sit down with you and just talk with you and find out what's been going on. We want to find out why you've been having the problems you've been having, how long they've been going on, and what started them. So we'll sit down and do a consultation. And once we do a consultation, if it sounds like you might be a candidate for care, we're going to go ahead and do an exam to see if your particular problem is rooted in a problem in the upper neck. Now, like I was describing before, there's a number of ways that the upper neck can be affecting your body and your brain, from the hydrodynamics, the blood flow to and from the brain, the limbic system, direct misalignments and pressures on those nerves, and posture changes. All of those are related because they have to do with the nerve signals and blood flow to and from the brain. But we're going to do an exam to find out what is the cause of your problem. What is the root cause of your problem? And if we find that it's coming from the upper neck, we're going to take very specific three-dimensional x-rays. And I don't mean three-dimensional as in they're a 3D image, but we take them from three separate dimensions so we can find out exactly where the bones of the upper neck are in relationship to one another from all directions. And that allows us to do some very specific calculations. Now, when we calculate the misalignment, what we're doing is measuring the bones, the shapes of the bones, as well as the relationship of the position of the bones to see if they're twisted or shifted out of place and causing some of the problems that you're experiencing. And so when you come back after we take some time to examine and evaluate those x-rays, we're going to sit down and show you exactly what's going on. And if this is something that's correctable, which in many cases it is, then we're going to be able to do an adjustment, a correction to that alignment. And we use a percussive sound wave instrument to do it. Now you can see here that the advanced orthogonal percussion adjusting instrument actually releases a very subtle percussive wave. So we have from our x-rays very specific angles that we set this instrument on. Now, in order to make the correction to the upper cervical spine, we would have the patient lay down on their side. It would be a specific side based on their misalignment and their x-rays. And once they get positioned, we're going to make some small adjustments to make sure that the neck is in the exact right position for the correction. Now we actually measure the position of the patient on the table because we want to make sure that the angle that we adjust them on is exact according to the x-rays that we measured. So we measure the position of the person on the table, and then we recalculate the instrument based on the patient's position. And so we get this perfect angle, this exact angle that's specific to the patient on the table, the patient who's getting the correction. No other person will get that exact combination of positioning as well as angulation of the instrument. And so once we do the adjustment, we're going to be literally clicking a small button. It sends a single percussive pulse with the instrument sitting right off the ear. It is a painless percussive sound wave adjustment that's able to shift that upper cervical spine back into its proper alignment. And then after you rest for a few minutes from the correction, so your body can reset, we're going to take another set of x-rays to find out if your body responded correctly to that adjustment, and then we can make modifications accordingly. So everything that we do is defined and calculated before and after the correction to make sure that we are removing the interference from the upper cervical spine. And if that's done correctly, your body can start to repair and recover the way it's designed to from the beginning. Your brain is designed to control every function of your body, so if we can remove the interference in the upper neck, it allows your brain to do its job and start to repair your body, heal your body, and maintain the health of your body over your lifetime. We want to make sure that we can provide to you the best information and examination to find out if an upper cervical misalignment is something that you've been experiencing and may be causing your health problems. Please give us a call at 813-644-7190. You can also go to uccenters.com. We would love to talk to you about how we can help you and your family with your health.